Dr. Lockhart. I like your distractions. Hi, Yolanda. Okay, so I'm going to give it another minute and then we'll start. That's because we're probably the only ones that get this excited about talking about anxiety. Hi, Jess. All right, guys, so we're gonna get started. So today's live is about social anxiety, what it is, what the symptoms look like, and what we do with it. So I got so many questions about this time. So I'm going to first just explain what social anxiety disorder is. And then somebody actually asked a really good question that was, can you tell me what social anxiety disorder is, but in not such a clinical manner? More so in a everyday, what does it look like, in the moment situation, which I thought was important because a lot of times the clinical symptoms are a little bit hard to translate into everyday life, and they're actually more for the benefit of the evaluator trying to figure out what's going on. But it's hard to apply those rigid symptoms to everyday life. So I thought that was actually a really good question, and I'm definitely gonna make sure that I hit on that. So we'll talk about what social anxiety disorder is, what the symptoms are, and then I'm going to go into a bunch of your questions, and then we'll end on some strategies to manage social anxiety disorder, go through a couple with you, and then if we have time at the end, I'll take additional questions from here live. So social anxiety, again, one of the biggest misconceptions that people have about social anxiety is that they think it's somebody who doesn't like to be around large groups of people, and that's it. And while that is part of social anxiety disorder, it actually can be one-on-one conversation. It could be a group of 3 people. It may be a group of 3 people they don't know, but a group of 3 people that they do know is fine. So it's very selective to the individual. There is not a one-size-fits-all approach for social anxiety as far as the context goes. The only commonality is that it involves other people, and we'll get to that in a second. So one of the biggest things with social anxiety disorder is the person's fear of being judged by others around them. It doesn't matter if these people are their friends or strangers. Some may feel judged by friends, but not by strangers. So when you are evaluating somebody, you have to ask very specific questions. So people who have social anxiety disorder obviously tend to avoid social situations. They also will tend to make a lot of excuses. So this is how it translates into everyday life. You'll frequently hear them say, "I'll meet you there." They will often drive themselves, so this way they have an exit if they need to. It makes them feel more in control. Also, people with social anxiety disorder, they tend to bail on plans a lot last minute because the anxiety gets to them. And again, the biggest thing is this perception that everybody around you is in some way, shape, or form going to judge you, and that judgment's going to be extremely negative, and that there's nothing you can do about it. So if you go into an environment and you are petrified that you're going to be judged, you can imagine the type of behavior that you may display. Typically, someone with social anxiety disorder is going to come off as shy, maybe aloof, disconnected. They may even come off rude because they're not engaging. They seem uninterested or disinterested, when really it has nothing to do with that. It's that they're kind of paralyzed in those situations, and it's easier for them to just stay quiet. Because if they say something, what if it's wrong? What if it's stupid? What if everybody laughs at them? What if no one likes them? What if they're just pretending to like them because they feel bad for them? What if they really shouldn't be here? It's just their best friends here, and then they felt like they were the third wheel, so they invited them because they felt bad. All of these are very common thoughts that go through someone's mind with social anxiety disorder. And then there's the obvious one that most people know about, which is the idea of public speaking. Some people do not like getting up in front of crowds and talking. They will avoid it at all costs. So when you're in these situations, if the anxiety becomes, because somebody had asked me this, social anxiety disorder is different than panic disorder. Can you have a panic attack if you are socially anxious? Yeah, sure. If the anxiety is that bad, you can have a panic attack almost kind of as a result of your social anxiety if it is not managed properly. Yes, that can happen. It's not that common, but it can happen. And then somebody asked what the difference was between social anxiety disorder and generalized anxiety disorder. So let me just kind of explain this quickly. Social anxiety disorder is this intense, extreme fear of judgment from others, of sounding stupid, of not fitting in, always kind of feeling like on the outside. Large groups, small groups, they just don't feel comfortable in their own skin. And it's very outward based. So their mood, their perceptions of themselves, their image of themselves, the way they view themselves in relation to the world is largely contingent on their perception of what they think other people think. So it's very confusing. It's based on their perception of what they think other people are thinking about them. So other people are needed for social anxiety disorder to exist, other than the person having it. With generalized anxiety disorder is very much this way, meaning you're in your head. You don't need anybody else around you to have generalized anxiety disorder. You can do that one all on your own. You can worry about your finances all night long for hours. You can worry about your health to the point of missing work, not sleeping, not eating, where it becomes very dysfunctional and isolating. So that's the difference between the two. One is kind of within the person and it's worry and it's all within their head, whereas social anxiety disorder has very much this kind of outward feel to it and is contingent on your perception of how others view you, which just that whole statement alone is extremely problematic, and we'll get to that. So the next question that I got was talking about symptoms that aren't necessarily clinical, but that are applicable to social anxiety. So where will you see this impact? Probably mostly in dating. Imagine having social anxiety disorder and having to do online dating. That is torturous, absolutely torturous for people. The online part, maybe they can do, but the actual meeting piece is so anxiety provoking for them that a lot of times they just won't do it. They will be behind their screen all the time, but the actual interaction, the social interaction, is extremely uncomfortable for them. Sorry if you hear my dishwasher going off, but what was very interesting over quarantine, and I'll just share this briefly, all of my patients that I had been seeing prior to quarantine for social anxiety, when quarantine hit, they actually told me they were feeling way better, that they didn't need therapy right now, and they were going to take a break. Fine, great. Here's the problem with that. They're feeling better because now there is this mandated, massive avoidance structure that they have to live by. They are not allowed to socialize. They are not allowed out of their house. There are no parties to go to. There are no restaurants to eat at. There are no dates to go on. There are no bars to meet up at. You can't even go to the gym. So for people with social anxiety, quarantine was a built-in avoidance. Of course they were fine. They were great. When it started to get a little tricky are when Zoom calls started happening, because people with social anxiety have a lot of difficulty sometimes with Zoom calls, because with Zoom, you can't really go anywhere. You have to be looking. And a lot of people with social anxiety disorder assume that everybody on the screen is looking at them. They know, but they don't grasp the idea that there's 20 other people on this call. Why on earth would everybody be looking at you, right? Unless you were wearing some crazy looking hat, or, your hair was, bright green with blinking lights. Of course they're gonna look at you, but for the most part, nobody cares and no one's looking at you. So my patients with generalized anxiety disorder, my worriers, their anxiety spiked through the roof during quarantine, because now they have nothing to do but time to worry, to watch the news, to talk to friends, figure out school stuff, figure out camp stuff, figure out work, and how we're gonna negotiate all of this. So my patients with generalized anxiety disorder did way worse. However, the problem with the social anxiety disorder patients is that when quarantine was over, like it is, hopefully slowly going into the green, what do you think happens with the social anxiety disorder patients who were great this whole time because of this built-in structure of avoidance? I want to see if you guys can get it. What do you think started to happen to them when we started moving into the green phase? Anyone want to take a guess? I know you guys know. I'm gonna call on people. Yeah, all my lives are saved in IGTV. Yes, high anxiety. So all of my patients who had social anxiety disorder prior but felt great during quarantine, their anxiety is through the roof right now. Which is why I always tell people the best time to get therapy is when you're feeling good, because that means you are in kind of prevention mode. You're able to concentrate, you're able to focus because you feel good, you can learn the strategies better rather than working backwards from a crisis. So as much as I wanted them to be in therapy, even though they felt good, they didn't. So their anxiety is spiking considerably high. Sleep is disrupted. They are having to reintegrate themselves into the workforce when they haven't seen people for a while. They are, kind of socially expected to go back out with their friends, maybe go on dates, take classes, go back to school. So they have to reintegrate to every single social situation at the same time. When does that ever happen? It doesn't. Yeah, you go back to school and maybe you go back to the gym at school, but to go back to everything socially all at once for someone with social anxiety disorder that's had a break for a couple months, this is really tough for them. My worriers, general anxiety disorder, their anxiety went down. They still have their worry about, will I get sick? Well, that, but generally speaking, they are relatively speaking, they're okay. They stayed in therapy throughout because they had so many worries and worked through it. And so now the quarantine's over, they're feeling a little bit better. One of the things for social anxiety disorder, like I was talking about, it's very much the person's misperception of how other people view them. So let's say I get up in front of the class and I have to give a speech. And I give my speech. And let's say my speech was great. But because of the way I have viewed myself my entire life, and that's a whole other live altogether on why patterns develop, but let's just say I have really low self-worth. I've been kind of taught that my opinions don't matter my whole life and that my voice doesn't really make a difference. I'm going to get up there and I'm going to give this speech and I'm going to immediately start having thoughts like, these people could care less what I'm saying. I'm going to sound like an idiot. I'm not smart. They're not going to gain anything from this. I am putting my childhood patterns that turn into assumptions right on these other people who are watching me, when not only do I have zero control over what they're thinking, but the likelihood that they're thinking what I'm thinking is slim to none. Why? Because how many of them have had the same exact upbringing that I did? None. How many of them developed the same exact coping strategies, maladaptive patterns that I did? None. So everybody's coming to this classroom with their own baggage and their own perceptions. So to think that everybody's going to view me from my perception, it sounds a little narcissistic. However, it is not narcissistic, and here's why. People with social anxiety do not like how they feel. They don't want to feel like this. They know that what they're thinking is wrong. They know that. They just can't stop because they always have the what if that comes next. Hi, Sherry. So they always have the what if. Whereas if you're dealing with a narcissist, let's say, that's not even on their mind that they're wrong. So a lot of times social anxiety disorder looks selfish. And I'm sure people watching this or people that you know that you think are selfish may really be dealing with social anxiety. I'm not saying that you immediately forgive them for being selfish, but just take a different look at them and kind of see if it's more of a social anxiety thing than a selfish thing, because social anxiety a lot of times looks very selfish because their plans are based around themselves feeling safe, where they go, what restaurant they eat at, how close they are to the bathroom. They're the ones that want to drive. They have to see a movie at a certain time because they need to make sure that they can I mean, there's so many rules to live with social anxiety disorder. So it looks like it's your way or the highway, when really it's not like that. It's not a narcissistic trait. And I'll tell you a funny story. Years ago, I was working with a student. She must have been freshman or sophomore. And she had such bad social anxiety disorder that she couldn't even go to Dunkin' Donuts before her classes because she was so anxious that she would walk into Dunkin' Donuts and that everyone would look at her and that she would drop her bag, that her change would go all over the place, or she'd spill her coffee. So she would fully avoid that situation. So what happens when you avoid things out of anxiety to not feel it? Your behavioral repertoire, your world gets significantly smaller. In an effort to not feel anxious, yes, but you end up closing your world so much smaller. And with that comes significantly more anxiety. So I'll get to this later, but a lot of people believe that if you avoid your anxiety and you avoid the triggers, you won't feel anxious. And that's true for about 5 minutes until it comes back and beats you over the head for the next 5 years. So we'll get to that. But so this patient that I had had been working with her for a while, so I had a good rapport with her, which is why I could say to her what I said to her. I would never say this to someone in early sessions, because it just would be really inappropriate. But she was talking about this Dunkin' Donuts experience and how she went and everyone was staring at her and everybody was looking at her and she dropped her change and everyone was annoyed at her. She was holding up the whole line. And I said to her, now remember, someone with social anxiety disorder tends to have lower self-esteem because they view themselves in a poor way and assume that everybody else views them in the same way, if not less. So I asked her, I said, so all these people are looking at you. It's 8 o'clock in the morning. This was at Penn also, mind you. So these kids were studying and it was either finals or midterm week. So everybody is in like when you go into study mode. You don't know what season it is, what day it is. So I said to her flat out, so you walk in, everybody's looking at you, everybody's talking about you in their head, everybody stops what they're doing. This was before cell phones, really, so no one really was on their phone. But anyway, long story short, I said to her, so let me ask you a question. What makes you so special that everybody in Dunkin' Donuts during exams took so much time out of their day to look at you, judge you, ruminate about you, and continue to think about you for the 10 minutes that you were in the store? So much so that they completely withdrew from their own lives. What makes you so special? And she just kind of looked at me and I didn't know if she was going to throw her shoe at my head, cry, or walk out. But she just sat there and she looked at me and she goes, oh my God, I'm not special. I'm not special. And she got so excited because it finally clicked for her that the idea that those people would go through all of that just for her seems absolutely absurd. So I like to use that example because she really got so excited when she realized that no, she was not that special for everybody to stop their life for her. And that's why it can seem narcissistic at times, because the expectation that everybody's going to drop everything and focus on you, it seems selfish, but there's a difference between the two. People with social anxiety disorder are petrified of this. They don't welcome that. Someone with narcissism welcomes other people. Whether it's good energy or bad energy, they don't care, they want it. So they don't want to fix that. They would never come into therapy for something like that. So is that clear with the difference between those two, and kind of how the symptoms play out? I think everybody. Okay. All right, so the next question that I got was, where does social anxiety disorder come from and what makes it worse? So let me tell you first what makes it worse, because what makes it worse is just one thing: avoiding it. That's it and that's all. You avoid the thing that you're anxious of, it will get worse. That's literally the only thing that'll make it worse. Where does it come from? So this is a little bit trickier. There is data that suggests that, there's a hereditary component. If your mom has it or your dad has it, that you may have it, or just if you have generalized anxiety disorder, then one of your kids may be more likely to have anxiety, not necessarily that form. But I am very big on patterns of behavior. I think we're maybe born with a predisposition to something, but it depends in the environment that we grow up with. We are used to what we grow up in. We are familiar and comfortable with the patterns that we grow up in. So I think that maybe we have a predisposition, but it's the way that you are kind of shaped throughout early childhood that I think makes a difference, whether that anxiety fully comes out or it kind of lays low or it just never rears its head. You're going to model your parents. You're going to model your caretakers. You're going to learn the best way to respond to them to get your needs met. And that could be very toxic. It could be very loving. If you have an alcoholic father and you need to just get through life, when dad comes home on Friday nights and you know he's drunk, you're going to go upstairs, you're going to close your door, you're going to lock it, and you're going to wait until Saturday morning. That's a coping skill. That's an avoidance skill. So fast forward 30 years, let's say. When somebody makes you uncomfortable, and that was the pattern that you were used to, are you going to be more likely to withdraw and avoid? Or are you going to be more likely to connect? What do you think? Anybody? Anyone? No one? Withdraw. So you're going to be more inclined to withdraw from situations with people that make you uncomfortable, because that's what you're used to. Yes, hi, loud mama. Now imagine how that pattern will affect you throughout the rest of your life if you don't work on it and you don't notice it. You will have a really difficult time dating. You will avoid conflict like the plague. You will be one of those people, more likely than not, that avoids conflict, will do anything you can to not get in a fight with somebody, which often looks like putting your needs second, right? And if you let somebody know that you're willing to put your needs second, you're going to attract somebody who is completely fine with that. So that's where it comes from. I mean, there's many different patterns that can result in social anxiety. I mean, you could have been bullied growing up, and you kind of took that internalized message from being bullied and applied it later in life. Or your parents could have had extremely high expectations of you that you could never meet, and you just never felt good enough, and so your self-esteem was really low, and you just assume that that's how everybody else sees you, that you're not good enough, so it's very uncomfortable to be in a group situation or to have connections or have friends. So it's pretty pervasive across relationships, in particular, social anxiety. So that's where it comes from. I'm giving you a very vague answer, but the easiest thing for me to tell you is what makes it worse? Avoiding the situation that makes you anxious. That's it, and that's all. If you're anxious to go to the movies because people will see you walk in and what if you fall and they may think you're stupid or whatever, the best thing to do is to go to the movies. Because what that does is it gives your brain a new experience, a real experience of what really happened in the movie theater, not what you think would happen in the movie theater, but what really happens. Your brain gets this new experience of absolutely nothing going wrong. And from that, then, you get reinforcement, right, that you're okay and that no one's looking at you, no one cares, you're safe, no one's making fun of you, and you actually feel good. So because of that, the likelihood that you're going to go back to the movies again or maybe go out to dinner with a friend just went up. Because before that, all you were doing is playing out possible scenarios in your mind, assuming the worst and not taking any action. So avoidance continues the process of anxiety. Doing the thing that you avoid that will give you a new experience that discredits the other one, gives you a sense of mastery, gives you some self-confidence that makes it easier to do it the next time around. Okay, somebody else, and this is a really important question because sometimes this is a difficult, what's called differential diagnosis, meaning trying to figure out which diagnosis the person presents most with. Somebody had asked if trauma can be an underlying thing that worsens anxiety, especially social anxiety, and yes, absolutely. With a trauma response or PTSD response, your body, your physical self, neurological self is on high alert. You are on constant watch, so to speak. Your body is on constant watch. So your amygdala switch is turned on, you are in fight or flight mode, and you're on guard your whole life until you work through things. So if you feel that way and you're in a social situation, you're probably not going to be super social. You're probably not going to run up to the group and introduce yourself because you probably have some sort of distrust in other people, particularly strangers or family members. other people's family members. A lot of social situations can be triggers for people with trauma. So it would not be uncommon for people with trauma to appear like they have social anxiety. The key difference is that post-traumatic stress, that avoidance is avoidance of anything that triggers the trauma. Whereas social anxiety is avoiding anything that makes you feel judged. So it may look the same on the surface, but the fundamentals of it are very different. I hope that clears that question up. It was actually an excellent question. You also treat them very differently behaviorally. Is it common for those with social anxiety disorder to use alcohol? Yes, extremely, very, very much so. That is why cocktail parties came about. Can you have both? Yeah, you can have both social anxiety disorder and PTSD, but the PTSD would kind of trump the social anxiety disorder. Social anxiety disorder would be more of a symptom. Alcohol use in social situations. A glass of wine when you're going to a party and you don't know somebody, it's going to make you more social. I mean, we can't deny that. If I'm going to a family event, like it's Thanksgiving, I am going to have a glass of wine before I go, because that would be in my best interest. However, if you are drinking at every single social event because you're already assuming it's going to be terrible, and you're drinking, or a bottle, yes, I didn't want to go that far, but yep, and you're drinking before you even know who's going to be there, you don't even know what the situation is, you just know that whatever it is, you can't handle it, and it's just way easier to be drunk or buzzed, because then you don't care as much what people think, so you may be a little bit more social. It's very common that people use alcohol and drugs because of social anxiety disorder, yes. Here's the difference, though, between having a glass/bottle over Thanksgiving or Christmas versus not being able to go out socially ever without drinking. There's a very big difference. One situation is kind of like, you know the trigger, it's acute, it's gonna go away, life goes back to normal afterwards. With social anxiety disorder, it doesn't work like that. It's chronic. So if you have to risk feeling this way, why not numb yourself through it? So that's kind of the mentality with this. And it is a very high comorbid diagnosis, comorbid meaning social anxiety disorder and substance abuse. And it's for this exact reason. You know, you have that friend who's super quiet and you get 2 drinks in them and they're the life of the party. So imagine somebody with social anxiety disorder who feels so badly about themselves getting 2, 3, 4, 5 drinks in them, and all of a sudden they're the life of the party and everybody's gravitating towards them. They're gonna like that. But the problem is that's actually an avoidant strategy of the internal discomfort that they live with constantly, and it's not a healthy coping strategy. So yes, that's very common. Is it common to see social anxiety disorder with ADHD? Yes, absolutely. I don't work so much with ADHD or ADD. I usually refer out for that. But I can tell you that adults who have ADHD definitely have reported feeling awkward, feeling out of place, feeling like they can't grasp what's going on. It's hard for them to have multiple conversations at once. It's hard for them to make plans, to organize plans. It's hard for them to remember to show up for things. And it's hard for them to navigate a social situation. So think about it. You are so anxious as it is. On top of that, you have difficulty navigating your world. You have trouble kind of taking in information and figuring out what to do with it and how it all fits together like a puzzle. So imagine going into a situation and then also having to do that. It's extremely difficult. It's absolutely frightening. And so that's where the social isolation comes into play. There's a lot of social isolation with social anxiety disorder, which is why a lot of people who have this also have depression, because they isolate themselves. Eventually people stop asking them for plans, which is kind of this weird good and bad thing for them, but then they're disconnected from people. And then they get this relief because they don't have to be on guard and anxious when they are out, which is why quarantine for them was the best thing that could have happened to them. But for their social anxiety disorder, it was the worst thing that could have possibly happened to them because now it's going through the roof. So a lot of you are asking about other anxiety disorders. They're all tied into each other, but for the sake of time, I can't possibly address all of them. This will be saved on my IGTV on my Instagram page. So in the beginning, I talked about generalized anxiety disorder and social anxiety disorder and how they're different. Talked a little bit about post-traumatic stress disorder. So feel free to listen to this, but to go through all of these, it would take an entire semester. So I'm giving you the abbreviated version. Does social anxiety disorder go away? If you are an anxious person, and you've always been an anxious person, you will always be an anxious person. However, you will be an anxious person who has extremely good coping strategies so that you don't need to drink a bottle before Thanksgiving dinner. You maybe drink a half a bottle. Or maybe, you used to avoid going to a graduation party, but now you go. Maybe you don't go to all of them, but you go. So does it go away altogether? No. And that's the expectation that sometimes people set for themselves, which we fail, and then it just keeps maintaining that anxiety and that low self-esteem. We need the emotion of anxiety because anxiety at a certain point is a motivating factor for us. For example, if there was a lion chasing us down the street and we had zero anxiety, we would just stand there and look at it and then it would eat us. During quarantine, if we had no anxiety at all, like a complete and total absence of it, we would have zero motivation to have quarantined ourselves. Nobody would have had any fear. We all would have been out and about. It wouldn't have mattered. We wouldn't have taken precautions. We would cross the street without looking. So you need anxiety. It's a motivator. So yes, you will always have anxiety because you need it to survive. The degree to which it's heightened depends on your coping skills. So get the idea out of your mind that you need to be anxiety free. I hate that. It makes me cringe. Or that you need to get over anxiety, or how do you beat anxiety? You don't. It's there. You learn how to live with it so that you can be the best person you can be by managing it effectively. Hope that makes sense. Can I pass it on to my sons was the other question. And that kind of goes back to what I was saying before. There is a component where, if mom has anxiety, she could, there could be a hereditary component to that. Sure. But again, it may not manifest as social anxiety. It may not manifest at all. If you grow up in a very calm, non-toxic environment, it may never come out. But if you grow up in an environment where you have alcoholic, abusive, neglectful, really a lot of emotional stress in your household, you're going to develop and learn stress-related coping strategies that are maladaptive that you'll adopt, and that will bring out the anxiety. So you can pass it down, but that's not really the main issue. The main issue is, let's assume you pass it down. It's how are you going to teach your kids to cope with anxiety when they're younger, so that they learn effective strategies so that they can maintain that throughout the rest of their life. The worst thing, and if I have parents on here, I apologize because this is probably going to make you angry. I am a mom, so I know why this would make you angry, and Dr. Lockhart, I know you're going to agree with me on this. For kids who may or may not be predisposed to social anxiety, when your child experiences some sort of negative emotion, they're sad, they're crying, they fell, and they're not injured, a friend is fighting with them, didn't invite them over their house, they didn't make the soccer team, they got a B when they should have gotten an A. Please let your children manage those emotions on their own. Be there with them, but let them develop what's called psychological immunity, meaning they not only know how to handle those emotions internally on their own, so that when they're an adult, they don't develop some sort of anxiety disorder because they don't know how to regulate their own emotions. But you're also sending your child a message that they are not capable of handling their emotions. And that becomes a self-esteem issue again too. So I think it's really just more of passing it down to your kids. I think it's what you do with your own anxiety, how you cope with your own anxiety in front of your children, how anxiety is talked about in your house. Is it talked about at all? Is it ignored? Is it looked down upon, like you're weak? It depends on so many variables, but my biggest advice to you would be, let your kids feel their emotions. Let them get through it. They will be fine. It builds resiliency. It allows them, when they get to college, to be able to handle things that are thrown at them. I see a lot of college kids, and all of them come from amazing families. Yet they all fit this very similar pattern of, they grew up, they were straight A students, played every sport, they were like these perfect children. And they get to college and they completely fall apart. And it's really because, and again, it's not done maliciously at all. This is completely done out of love for their children. But when you are constantly jumping in to save the day meaning take their negative emotions away from them, you are not allowing them to develop what's called affect modulation skills, which is the ability to regulate your own emotion internally. You're not giving them the opportunity to see how it works, and you're not giving them the opportunity to see that they can do it. So these kids get to college and they get a B instead of an A, and the world falls apart. A boyfriend breaks up with them and the world falls apart, more so than usual. The anxiety they have is so abnormally high because they don't have the ability to regulate it, because they were never taught that. And parents who jump in to save the day aren't doing it because they want to be asshole parents. They're doing it because it's their child, and it's brutal to see your child in emotional pain. It's the worst thing in the world. So it ends up being more about the parents than it is the kid. It's the parents that have to learn to sit with their own anxiety and not try to avoid it by taking care of the situation, if that makes sense. So remember I said that the only way anxiety gets better, or the only way anxiety gets worse, is if you avoid it. If I'm really uncomfortable that my son's crying because he didn't get on the soccer team and he's hysterical and he's 6, and I'm so upset about it, I call the soccer coach. I'm not calling because of him. I'm calling because it's intolerable to me. And by doing that, I send him a message that he can't handle his own anxiety. And then that manifests into social anxiety, generalized anxiety, a whole bunch of things you don't want. So, then somebody asked an odd question. If there's any psychologists on here, I kind of want your opinion on this. I've never heard of this. Somebody asked why psychologists frequently deny giving a diagnosis of social anxiety disorder. I've actually never had that experience. I've never had an experience of people not getting reimbursed or any. I've never heard that. So unless anybody on here knows any different, I've never denied a diagnosis of social anxiety disorder. It's pretty common, so it's pretty commonly given diagnosis. So I'm not quite sure about that. So I hit on the majority of the questions that people asked. Oh, somebody wanted to know my top 3 messages for battling social anxiety. And so my first message to somebody who's battling social anxiety is to tell them to stop battling anxiety, because you can't battle it. You won't win if you battle it, because battling it is avoiding it. Sitting with it and letting it pass, well, that's something different. So let me go through my 3 top ways that I like to manage social anxiety. So the first is I like to use a lot of metaphors because I think it helps people understand a little bit better. So I like to, this is in my highlight section too, under monster. It's one of the strategies that I used. If you, I'll draw it, but don't laugh at me. So here's you. That's you. Right here is a pit. And if you fall in the pit, you die. So you don't want to go in there. On the other side of you is this massive, huge monster. He weighs 600, 700 pounds, and his feet are nailed into the ground. He is never, ever going anywhere. His feet are in the ground. This is the anxiety monster. This is you. Here's the pit of death. And in between the two of you is a rope, and you're playing tug of war, okay? If we look at it from an anxiety standpoint of not avoiding discomfort and instead sitting with it, how can you win this game against the monster? Anyone want to take a guess? Remember, his feet are nailed into the ground and he weighs 700 pounds, and there's you. How can you win against the monster? What do you think you need to do? And I know some of you already know the answer because I did this before. What do you think? I'll leave that. My masterpiece. How can you win? Okay, someone said let go of the rope. Anyone else? Go of the rope. Let go. Yep. You make friends with it. No. He's a monster. He's anxious. Sit and don't battle it. Yeah. So, hi mainline tonight. So, here's the thing. If you keep yanking on the rope, here's what's going to happen. You're going to get exhausted, right? Just like your, I lost you, sorry. Just like your anxiety. You are going to get exhausted. You're going to lose. You're going to fall into the pit. You're going to be so exhausted that you're not going to want to do anything anymore. You're going to put all your effort into beating the anxiety monster, right? Which is essentially what people with social anxiety disorder do. They're constantly living throughout their day trying to battle this social anxiety monster by, should I go here? Should I not go here? Should I do this? Is this going to make me anxious? Should I not go to this party but go to this party? Is there too many people here or too little people here? Who's going? Who can I go with? I can't walk in alone. It's absolutely exhausting, right? So, if you don't want to avoid the anxiety, what do? Well, you drop the rope. And what that means is you stop the struggle. Is the anxiety still there? Yeah, the anxiety monster's still there. He's not going anywhere. His feet are locked into the ground forever and ever and ever. You can come back and pick up the rope and engage in that struggle with him anytime you want. And chances are you're going to go into that struggle when you're stressed. Because when we're stressed, we go back to patterns of what's familiar because our brains get lazy, because they get overwhelmed, so we go back to old patterns. So chances are, if it's the holidays or you're having a bad day at work, you may go back and pick up the rope again and struggle with the anxiety monster because that's what you're used to and familiar with. But if you drop the rope, then you're not as tired. The anxiety's still there though, but you're not struggling with it. But it's still here, but it's not here. There's a difference. It's decentered now. It's here, it's not here. So, dropping the rope allows you then to gain your energy, gain your strength, and go focus and go do something that you enjoy a hell of a lot more than struggling with anxiety and trying to push it away by constantly battling with it. You waste so much time and effort and energy and life and your presence and on what? On battling something that's not going to go away because you're battling it. Every time you battle it, you make it stronger. So to make it weaker, you drop the struggle. Now, people think that means avoiding anxiety. It's not the same thing, okay? Avoiding anxiety has nothing to do with dropping the rope. Avoiding anxiety is no different than still pulling on the rope and struggling. It's the same thing, okay? Avoiding it, struggling with it, pretending not to think about it. Somebody said this on here too. When you try to not have a thought, what happens? If I tell myself, don't think about my glasses, all I'm going to do is think about my glasses. Because in order to not think about my glasses, I have to say the word glasses. Don't think about my glasses. So neurologically, cognitively, it's impossible. So if you drop the rope and your hands are free, and now you're open to do whatever you want, all your attention and your effort and energy can go focus on what it is you want to do. If you feel like fighting with your anxiety again, great, go for it. But it doesn't take you anywhere except exhaust you, make you miserable, isolate you. Because if you're playing tug of war with this monster, all your friends are at the bar getting drinks. All your friends are out to dinner, or they're at a wedding, or they're at a work event, and you're here struggling with the monster. Now, the equivalent of this would be you at the bar with them, and you standing there playing tug of war with the monster in your mind. Like, I wonder if he's talking about me. I wonder if what I just said is stupid. Oh, these guys definitely hate me. I have to get out of here. I'm never coming back. I just said the stupidest thing. That's the struggle. Okay? So I'm not telling you to ignore it or forget it. I'm telling you to drop the struggle, refocus somewhere else. You can go back to that anytime you want. People have the misconception that the only way you get over anxiety is by trying to forget about it, get over it, get past it, and that's not how it works. And that's why people who drink to get rid of social anxiety just doesn't work. One, because you get rebound anxiety because of the way alcohol works on your brain. Two, you internalize the message that you can only be social if you're drunk. And if you already have low self-esteem, and now you also have, I can only be social when I'm drunk, well, that's going to do a number on your self-esteem too. Nobody likes me unless I'm drunk. that's pretty brutal. So you internalize that message. You assume that you're so boring or you're so stupid when you're sober. So that's another thing to keep in mind. So my second strategy that I like to do a lot is I have people rank the order of the things that they are uncomfortable with socially. And I have them make a list. And then I have them break the list down even more. And then I have them break the list down anymore, because they'll come in and say, I'm socially anxious around people. Okay, well, I have no idea what that means. What people? Where? With who? How many? Do you know them? Do you know both of them? Are you driving? Are you at a restaurant? Give me the exact situations that make you anxious, because you want to make sure that you're targeting that specific thing. Because let's say they're not anxious with two people at a restaurant, but they're anxious with two people at a bar. You want to make sure that you decipher between the two, because if they're okay at the restaurant, well, that's a strength. So you want to be able to highlight that and say, okay, well, clearly you have the skills to be okay when you're at a restaurant. So you have that ability. Now we need to translate it over here. So depression. Yeah, alcohol is a depressant. It doesn't mean depression. It's a depressant meaning it lowers a lot of levels in your body. It depresses your breathing. It suppresses your brain. Not like depression, that kind of depression. And so I have them make this list, and then what I do is I have them rank them. And each thing can only have one number. You can't use the numbers more than once. And I rate them from the easiest thing that causes them the least anxiety to the most. And we go through them one by one, either through visual imagery, or if possible, we actually do the exposure itself. And the expectations before it, the expectations during, and then after. And I can tell anybody, when it comes to anxiety, the anxiety that you think you're going to have in a situation is 99.9% of the time going to be a hell of a lot worse than the anxiety you actually have during and after the event. Okay? So if you can hold on to that little nugget of information and just know that if you can get through the anticipatory anxiety, okay, then you can get through this. And I say the 99.9%, I have 2 minutes left, because I did do an exposure with somebody who was scared of elevators and we got stuck. So that was the only time that ever happens. So that's what I do, and then we go through exposures, and it's very helpful. But I don't teach them to get rid of the anxiety. I teach them to sit with the discomfort, get used to the discomfort rather than trying to push it away. That's the only way that anxiety starts to dissipate. Okay, so thank you guys very much. I have like 1 minute and 20 left. This is going to be saved on my Instagram, my IGTV story. So if you go to my page, you click on the little TV thing, I'll save it there. And next Tuesday, we have a guest coming on, so I will talk to you about that over the week. Thank you guys for sending so many questions ahead of time. They were really good questions. I really enjoyed answering them. I hope it was helpful. Any questions that you have, feel free to DM me. I am happy to answer them. And no personal therapy questions, please. Instagram is not therapy. So, okay, that's all I have. I hope everybody has a good night, and I will talk to you soon. Take care.